Welcome to my educative videos. We have a lot, I think 1300. Today I'm going to talk about the brow and the importance of the brow position in the aesthetic feature. I hope you enjoy it. At the end we are going to let email and WhatsApp lines. If you have any doubts, you can send us, and my team and I we are glad to help you. Brow lift. The age is associated with brow dropping. Here we can see a nice eyeball color, but if you look, this patient has a sad, tired, and maybe older or angry look. And why this? Because this patient have eyebrow dropping. You think is the eyebrow is in a good position, but it is not. Here is the inner, here is the middle, and here is the lateral eyebrow. Generally, with the descent of the brow, the inner and medial part of the eyebrow stay in the position, but the lateral drop. What we have here is the eyebrow lashes, but if you compare, this skin is thin, this skin is thin, but this is not thin. This skin, all this skin belong to the eyebrow. All this belong to the eyebrow. You can see this skin is thicker than this one. This is because the eyebrow drop, and the dropping of the eyebrow produce this effect in the look. Few facial features are as powerful as the eyebrow. If you look this patient, again, looks sad, tired, angry, elder. And why? A lot of patients come to my office and said, "Look, doctor, I'm not tired, I'm not sad, I'm not angry." People tell me, "Why are you?" And why is because the brow descend. You can see these horizontal wrinkles here are produced for the dropping of the eyebrow, and all this skin of the eyebrow descend in this way. The worst thing, the worst procedure that we can perform in this patient is a conventional upper eyelid surgery with a resection of the skin, because we are going to pull down the eyebrow, and the aspect of the face is going worse, going to get worse. We can conclude that the eyebrow are the superior aesthetic frame of the eyes. And if we can check this patient, we can see that the upper, the frame of the eyelid is going down here, you can see that almost occlude the pupil, and in this area is less. And for this reason, this patient have more wrinkles here, you can see here, than there, because the frontal muscles are contract to pull up the eyebrow in order to let this patient to improve the range of the view. Also, this patient have wrinkles here, wrinkles here. The worst things again that we can do, because this is the upper eyelid skin. The worst thing we can do here is the upper lid skin resection. Here again we can see furrows, deep wrinkles in the frontal area. The worst thing we can do here is to put botulinum toxin, because we are going to drop the eyebrow down. What we can do in this patient? We can make endoscopic brow lift. What is endoscopic? Is we are going to do a small incision in this area, in here and here, and with this small incision we work in all the frontal area, also in the tip of the nose. Here we work in all this area in order to rewrap the tissue. Endoscopic brow lift, through a small incision in the hair, a thin tube with a camera on the end is introduced. This allows the tissue and the muscles beneath the skin to be adjusted, correcting the crease and furrows and reposition of the eyebrow. Then we can see here, this patient is nearly 2001, 2002, and today I saw the patient and almost maintained the position that I gave 19 years. We can see the dropping eyebrow and here the reposition. Also, we eliminate the wrinkles with the reposition of the forehead. If we compare this look with this one, we can see here a sad, old, tired, and here a young, youthful, happy look. If we compare this patient, also the same, also with the CO2 laser, we improve all the wrinkles around the periorbital area. We improve this wrinkle, we tighten the skin, we produce a full face rejuvenation. Also, we can see here the nice position of the eyebrow and the nice result, almost without scar, natural, nice, beauty, young. I hope you enjoyed this video, and any inquiry you can send us. The final view. I hope you enjoy this presentation. My team and I wait for you in Buenos Aires, Argentina, and you can make your consultation. Send us a WhatsApp or an email with your pictures, and also what do you want to improve. In my website I have several videos, almost 1,300 videos, and you can see different kind of patients, and you can see the results. And if you have any doubts, please send us your email, photos, and we can help you to come to Argentina. Most of the patients perform their pre-studies in their countries and send us to check if everything is okay. Depend on the surgery is the time of stay in Buenos Aires. Buenos Aires is a cosmopolitan city. It's very nice. At this moment, very cheap. And if some patients have 2, 3, 4 days of the recovery and go to see the city, and others go outside to the Patagonia, the waterfall, the north. We are waiting for you. Send us information, send us pictures, and we can keep in touch.